It's Fill Your Plate Now, where every bite brings you closer to the farm gate and further from what's unhealthy. Now here's your hosts, Julie and Tammy, helping you live well by filling your plate well.
So Tammy, hot topic this episode, food is medicine.
Ooh.
And rumor has it that a conference that you just recently got back from, this was several of the sessions on food as medicine. Any other background on that?
Well, it was a national conference, so
Okay.
it covered a wide range of topics, but there was a predominant number of sessions on food as medicine because we're learning more and more about our foods, how they affect our body, even down to the micronutrient level, and all of that can be applied to helping everybody to be healthier. So I'm very excited about this session today.
I am, and my guest, I met her, I want to say, about a decade ago. I think, Melanie, you spearheaded this food forum. It was at the University of Arizona. And again, I think it was about a decade ago. You and I briefly met. And so we knew of each other. And I thought, oh my gosh, if this is such a hot topic, we have to bring Melanie on. So I'm going to give all of our listeners kind of your background, and then we're going to launch into some questions. Does that sound like a plan?
Sounds great.
Dr. Melanie Hingle is a community-engaged nutrition scientist and registered dietitian whose work bridges nutrition, agriculture, I'm glad that I see that in your bio, and public health. Her research focuses on how food environments and access influence health, especially for families at risk for diet-related diseases, think type 2 diabetes. She leads the NIH-funded FRESH Type 2 Diabetes Study, which evaluates the health and economic impact of providing medically tailored groceries to people managing diabetes and food insecurity. Two very important issues and aspects of someone that has to deal with that. In addition to your research programs, Melanie co-directs the University of Arizona Culinary Medicine Initiative, which connects nutrition science and culinary arts to help Arizonans prepare healthy, affordable meals. So if I went to that, or if I listened to you, I would be much more prescriptive even in the way I cooked. And on top of it, and the cool thing is affordable meals. So across your work, you have partnered closely with Arizona growers, healthcare providers, and communities, and you turn nutrition science into practical, real-world solutions, and that's what I love, practical, real-world solutions. You are a strong proponent of food as one of our most powerful tools for health, connection, and resilience. Melanie, welcome to our Fill Your Plate Now podcast.
Thank you so much.
So I'm going to launch right into a question. What do we mean when we talk about food as medicine? Pretend, I'm getting a clue on this. Tammy certainly understands it better than me as the nutritionist. But for the layman, what exactly does that mean for me?
Yeah, thanks for that question. Food as medicine is an umbrella term, and I did not invent it. It is a national, as Tammy knows from being at the FNCE conference, a national movement, and it encompasses a couple of different types of food-based interventions and prevention programs. So think of it as a pyramid. At the very bottom and foundation of the pyramid are nutrition education programs that we have available to all members of the public through government organizations, through schools, other community organizations. And that's really for primary prevention. So people get nutrition education to understand the basics of healthy eating and what it can do for you. And then on top of that, as the pyramid moves up and gets smaller, you'll see a little bit more intensive programming for people who have diet-sensitive illness or who are at risk for diet-sensitive illness like diabetes and hyperlipidemia or high cholesterol or high blood pressure, which are all diet-sensitive conditions. And those types of interventions or programs are a little bit more intense in that the food is actually provided to people a lot of the time. And that is in the form of, as what we're doing in the FRESH study, groceries or ingredients, or it could be something like a produce prescription that you would get from your doctor, actually a prescription to be able to buy more fruits and vegetables, and perhaps some ways to make that more affordable. And at the very tippy top of the pyramid is medically tailored meals. They're actually meals that are prepared and fully cooked and arrive at usually the person's home. And those folks are a much smaller group and need more intensive diet treatment. So it's this entire continuum, really, or if you want to think of it as a pyramid, which is, I've seen it visualized that way. But food as medicine encompasses all of those things.
Oh, so interesting.
It is interesting. And I know for years we have had prescriptive diets for things like diabetes or for heart disease or lowering your cholesterol. But I think the exciting thing is it's getting even more and more refined. How far do you see this going in terms of being prescriptive for your day-to-day conditions? Do you see something like if you have a cold, can you see what you need and dial in, or have your blood tested and have a diet sent to you on what you need to do to recover faster? Or where do you see this going? How far do you think it can go?
I love forward-looking questions like that in future, predicting the future. If I could right now pull out my crystal ball, I would say that we are on a trajectory that is food as medicine prescriptions will only increase. We have seen this in the last few years. It's definitely not as widespread as I would hope it would be. And right now, at this point, we're more in the piloting and testing phases to see how well it integrates with the healthcare system, because that's really where majority of these kind of really prescriptions come from, right? From your healthcare provider. And I would love to see that be a consistent offering across the United States. We have some work to do before that happens, certainly. But right now we are seeing those prescriptions being piloted in different places.
We have a lot of devices for a lot of things that relate to our health. Even our smartphones can tell us our steps, and we can monitor our heart rate, and we can have devices that monitor our blood sugar levels. Is there going to be a type of tie-in, especially for those that have illnesses or chronic illnesses that really are impacted by their diet? Is there going to be more of a tie-in or a merging of all these devices?
This is such a great question. There are all those things on the market right now, as you pointed out, and I think one tool that we've been using, and again, more in the context of research since it's not quite ready for prime time, is a continuous glucose monitor. And this is something that you can wear on the back of your arm or on your abdomen. It's a painless, tiny little catheter gets inserted right under the skin, and it reads your blood glucose level continuously through that sensor. And you can look at the data on a phone through an app that's connected to that sensor, and see how your body responds in relation to the food that you consume. So this is only one piece of information. It's not specific yet to the type of food, but we are very close. And current research right now is trying to figure out methods of determining what people are eating, not just sort of how much it spikes your blood glucose, but being able to predict using those data how much your blood glucose would go up as a result of you eating one thing or another. And so you can use artificial intelligence for this. And I have some colleagues at Arizona State University I'm working with right now who are doing that very thing. And so we're combining these different devices, the ones you listed, a lot of those, with the data that come from it, and getting feedback from the people who are wearing them to be able to help tailor dietary recommendations even further than what we're able to do right now. So I think that to me is one of the more, the ability to integrate data from different sources is a real strength of where we're headed as a field, and is kind of as a nod to not so much food as medicine, but more like precision nutrition, which is a word that's been used to describe what you're mentioning. But these things can absolutely go together. They're all about how do you promote your holistic health and figure out your, quote, best diet.
And with some of us that are so chronically ill in certain areas, and food is a serious impact, we need to take this seriously. If we have precision medicine through the food, we already have precision agriculture. So
That's true. It's all kind of going that direction. The
Right.
more we learn, the more we need to learn. But we're seeing more precision to everything we do.
Yeah.
And I will say, when I was at Fancy, I even saw some food companies that had prescriptive meals prepackaged and plans that they were selling to food service establishments like hospitals or long-term care. Um, are these even more prescriptive than what dietitians were already doing, or is this just kind of like those weight loss plans that give you the prepackaged meals? Do you see it going one way or the other, or is there a place for both?
I think there's a place for both, and I think the companies out there that at least some of the ones I've seen, and I've worked with several as well, those who are integrating those things are, I think, in the best position to really impact on people's health as well as thrive as a company, because you want dietitians or other experts in nutrition involved in designing those tailored either groceries or meals to make them really suitable for people. So I'm not sure. I would be very interested to hear more about what you saw at Fancy, but the companies I know, they hire dietitians to do that work that you're describing.
I know from certainly your bio and in just talking to you in general that you have a serious connection with agriculture. Obviously, you work for the Land Grant University. Is there a way for agriculture to get more tied into, I'm thinking the food companies, but who knows, maybe it's the nutritionists that are doing a lot of these specifically prescribed diets to maximize on the opportunities here, especially for people that need to have food as medicine as front and center in their lifestyles?
I think absolutely there's a place for agriculture to become even more connected. I mean, I think already it is through supplying the foundation of whatever the medically tailored groceries or meals or produce prescriptions. The We've been exploring it through a few different ways, and one and this works for depending on small scale up to large scale producers, I think, depending on the partnership. But locally, our Fresh project that we've had, the National Institutes of Health funded Fresh project, we have a partner called Pivot Produce, which is a nonprofit here in Tucson, but they connect. Their mission is really to connect local agriculture with end consumers. And the focus, because the person who is the lead of that, the director, is a former chef, has been often to connect agriculture with restaurants and local agriculture. However, in the context of our project, he's also worked closely with a healthcare organization with whom we're partnering, and a federally qualified health center. And so I think connections like that, they're not uncommon, especially now with, again, the food as medicine movement helps kind of bring light to that is really important, that we're a part of a food system and the agriculture is at the foundation of that, and it should be connected to these places. And why not directly, just as you would with a restaurant, why not directly to a healthcare organization as well? So we've been really fortunate to have a really strong partner here in Tucson, again, with that project. My other partner is a larger scale company, also with strong agricultural roots, and the creator or founder is actually a former agriculturalist in Yuma, and is from Yuma, and he works in California mostly now, but is coming back to Arizona. And that company is very large scale in California right now, delivering millions of food boxes to people, but having that strong background is really important to the success of the company, and also just the ability to scale and distribute because of the supply chain expertise he has and all the connections and his other companies that he has that are produce related. So I see it working kind of depending on your scale of production, any number of ways, but the key connections are certainly with healthcare, I think, in terms of enabling that food as medicine to really work.
That's great. One of the things I love about what you're doing is you have that culinary aspect there, because it's fine to talk about the science and look at the interaction, but to actually implement it and put it into practice for people, that's so important to be able to translate it from the science to the application. In doing that and working with the culinary aspect, Are you seeing any foods that are real superstars in terms of medicinally, or are there a few standouts to you, or is it the combination that you're looking at?
Yeah, we're not looking at individual foods per se, but I love that question because I think that the medicinal potential of food is certainly significant, and individually foods have impacts, as you know, and then together there's different ones. So that's the beauty of combining these different foods, is they do have these synergistic effects as well. So when we think about culinary approaches and helping people with the practical part of food as medicine, that is being able to identify foods and purchase them and acquire them and make them into something that you want to eat and enjoy them with enjoyable people. That the combination of different things is something we talk about, and how to up the nutrition potential of your meal in a affordable way is also something we focus on. And so, for instance, I'll give you an example. Something that we do not only in our Fresh program, and a lot of our participants are fairly low income, so we can't recommend super expensive things a lot of time, but spices are something, and herbs, fresh herbs are something that are pretty easily obtained, and you could grow them inside of your house or on a windowsill, and that have a big nutrition impact and also a big flavor impact, and really improve not just the health of your meal by adding a little bit of basil or cilantro, or you name your favorite herb. I like chives a lot and everything, but they have a health effect as well. So all of that's kind of additive, but these are just little things that we emphasize in our kind of culinary education part that I think are really make the difference and help people understand that eating healthy is not bad tasting, which I think sometimes people still associate healthy food with not good tasting food, which that always makes me sad. So I hope I can help change the mind of some folks.
Absolutely, yes.
Is it fair for me to say that you have clients, or at least at the institute, where you're teaching culinary skills to improve their eating? Is it fair for me to classify someone as a client of yours? And the only reason I ask that question is based on how I'm going to ask the next question. Imagine then that I am one of your students and I have a chronic illness. Maybe it's type 2 diabetes or severe allergies, and by diet, maybe they can be overcome. Have you seen anyone that has been able to reverse the level of their chronic disease because they've been making application of this food as medicine? And what has that experience been?
Yeah, I'll give you some examples. I mean, I think it's true for certainly when I practiced, when I was in practice as a dietitian, I would see this a lot. And this was, again, before the food as medicine sort of idea swept the nation. But the principles are the same, even decades later. And I still have students come to me and people I work with and who make dietary changes based on kind of foundational principles, which are really, again, kind of minimally processed foods and, whole foods and all those sort of basic nutrition things that you might imagine apply. And yeah, things like diabetes can be very well managed, if not certain cases reversed with major changes to diet, right? And the same goes absolutely for cholesterol and high blood pressure and all these diet sensitive conditions we have. Allergies and food intolerances are also very common among the general population, and these are I wouldn't say easily fixed, because you have to often eliminate things and then kind of introduce them back in, and there's a little bit of detective work going on. However, when you do figure out what the thing is that has been bothering you and not do that, and figure out a substitution for that, it's night and day. It could be night and day for people in terms of how they feel. And so 100% yes. Yeah.
And really kind of to piggyback on that, not quite as clinical, but yet somewhat, I'd be remiss if I didn't bring up all of the weight loss drugs now that we're seeing and the need to cut back on calories, because it's so extensive. I think it's 1 out of 8 is on some kind of weight loss medication. So, of course, you'd have to go to eating less and more nutrient-dense foods. But are you working at all in that area? And what are some of the things you would prescribe, I guess I would say, in terms of diet for that patient or that student patient?
Yeah. Well, I certainly, I indirectly do work in that area only because our healthcare partners and prescribe GLP-1 agonists, the drugs you're talking about, like Ozempic and Mounjaro. And they also, in our study, we need to account for those medications because they drastically change people's how they're eating because they're not hungry in the same way. There's lots of other changes going on that these medications cause that mean that they are different in the way that they eat and approach food than before. And so yeah, there's some things to consider for sure with those medications, and it depends on, of course, the dose people are on, what kind of side effects they experience, which often are affect your nutrition further. So, for instance, having a lot of GI side effects, people tend to have. Um, but I think because the quantity of food often goes down so much compared to the before they took the medication, one thing that people need to be very careful about is getting enough, definitely, as you said, Tammy, enough calories, but also protein in particular, because at some levels of dosage, it mimics almost like you're having a bariatric surgery and you're having, your just ability to eat enough food to maintain sort of your overall health is compromised. And you want to find the right balance of the medication and of course and still be able to maintain your health and eat the things you want to eat. But the quantity being severely reduced, you have to be very careful, as you're saying, around the quality of what you're eating. So it may be that we would adjust people or recommend a little bit higher protein of some kind, high quality protein. We would say, here's some really nutrient dense foods, the colorful foods, of course, but being careful with things like too much fiber, because that again can, be very filling and volume heavy, but then the calories are often not adequate if people are already eating a lot less. So there's just a lot of considerations. So hence the dietitian consult is super important for people to talk to them if you're on one of those medications.
I think we're remiss if we don't ask Melanie, what are the major illnesses that suit using food as medicine? We have mentioned, obviously, type 2 diabetes, but what's the list that you would go down and cite as the diseases or the conditions that someone should consider food as medicine?
Yeah, there's a whole range. And if you think about the conditions that are diet sensitive or diet responsive, certainly diabetes tops a list, and it's very, very responsive to diet and very sensitive to diet changes. As I mentioned before, conditions that are also somewhat responsive could be high blood pressure and high cholesterol. Sometimes those are also genetically very heavily genetically determined, so they might not be very, very responsive to diet, but still they'll make a little bit of a move. Um, People who are cancer survivors, and that's a lot of people in the United States, you have consequences of the cure when you're treated for cancer. And some of that can also be managed with dietary change or mitigated with dietary change. Not always, but I think certainly I know several colleagues and friends of mine are worried about recurrence if you have had cancer as well. And I think that diet is really critical for that. We've demonstrated that with a lot of research and following the recommendations for American Cancer Society, and again, high vegetable fruit intake and low refined sugar and low added fat diet and high fiber, all really healthy no matter what you are at risk for or have had in your medical history. Those are some of the major categories right now of food as medicine. I think also HIV and I'm trying to think if there's other ones, but I think again diabetes is the major one, and then the cardiovascular related diseases.
One of the things that I think is encouraging, I got the sense from you, Melanie, is that you can actually reverse or reduce the symptoms of type 2 diabetes using the application of food as medicine.
Right. Correct. Yes.
That's awesome.
Yes. I know. It's like magic, right? But it's not. You could actually achieve that with food, with just nutrition.
And the one thing about food that I love is it doesn't have the side effects that many medications have. It's a very mild way to change their blood glucose levels in this case, and not have any kind of repercussions, which medication can sometimes do.
Yeah.
So that's amazing. And kind of turning over to the preventive side, do you see a role for food as medicine in the prevention world? And if so, give us a couple of examples on how you think that would play out.
So I think that food as a primary prevention strategy is absolutely where we want to go here in the United States, and we're not there yet. And we can get there though. And I think in my career, if this can happen, if I can achieve this, this would be amazing. So here's how we get to food as a primary prevention strategy. Number one, we need nutrition education to be more and more integrated into medical education and into health profession training. Because right now we have physicians and other health professionals who graduate and are very accomplished in their area, but do not have this broad kind of health training. And nutrition is very, very small part of what people learn in medical school, for instance. And so I have some colleagues, part of our culinary medicine initiative is to promote more comprehensive nutrition and food education with medical education. So I have some physician colleagues who are really engaged in this as well, and we've worked on this the last few years around the state. So that's number one for sure in terms of primary prevention. And secondly, our food system. So going back to why we're here, part of why we're here to talk about agriculture, is really critical. And connecting the dots on the food system, you're growing amazing things and healthy things out there in Arizona and beyond. And we need to get that in front of people and affordable, and we need to help people prepare things that are tasty and they'll enjoy. So I think there's just a lot of pieces that fall into place, and that's really what that culinary medicine initiative that we're leading is all about, because it is about integrating these different ideas and helping people achieve this. What you said, kind of food first.
Food first. I like that. And it sounds like the farm to plate, farm gate to plate, which is our philosophy with this podcast, Tammy, as we talk on Fill Your Plate Now. So, and we recognize that there is quality food, especially at the baseline. I often tell people to just shop around. If it's the grocery store, shop around the outer aisle. And if you have a farmer's market, a good one with a couple of good farmers, then you need to go there. And we absolutely have the farm to plate down, I believe. But access is sometimes a challenge. So this is actually a two-part question. How do you look for the farm fresh? Because it is in the grocery store too. Tammy and I always counsel shop the outer aisle. But, so number one, getting access to that quality food. And then number two, you're selecting it. But then number two, what if you are a food insecure family and or you're just simply in a location that it's hard to get to quality grocery stores and quality farmers markets?
Yeah. Access is a real barrier to healthy eating generally, certainly in implementing any kind of food as medicine approach as well. So I just want to support the shopping the perimeter of the grocery store idea. I think that's a really easy, nice way of thinking about identifying foods, which really what you're suggesting and what that idea suggests is you'll find less processed or minimally processed foods around the perimeter than on the aisles. Which, by the way, I was at a grocery store I will not name recently and shopping for my father, who was looking for a kind of oatmeal. And I realized I don't go to those aisles very often in the middle. And there's a reason for that, because there were 40 types of oatmeal. It was overwhelming. So I sympathize with everybody out there trying to figure out what cereal or oatmeal or whatever they should eat, because it's not very clear from all the options we have. So I think that's the other point I would make too is you want to be able to have enough nutrition knowledge, and this is tough unless you're exposed to a program, an education program, or you know somebody, or you can, feel confident in your resources you can go to figure out amongst those 40 options which is the best. And then also amongst the 40 options, which is the best and most affordable. And then amongst those 40 options, which is the best, the most affordable, and the best tasting, because that's what people are gravitating toward, and convenient, right? So that's the balance we're trying to strike here, because I think when you shop the perimeter, you get healthier, less processed foods, but you must prepare them. And that's different than the middle aisles, where everything is a lot more pre-cooked or convenient or, instant. And so it makes sense to want to have some of those options as well. So can we devise a strategy? And this is what we counsel when we counsel people, including people who are very low food security, do the best you can with the fresh items. And here's some places and resources to access those. And if maybe it's us bringing food to people, that is a thing. We deliver food to people's homes. They can come to a central location, like the medical home where we're doing our intervention. And then here are some resources in addition to that to help you prepare them in a way that's not going to derail your entire day, because nobody has the whole day to plan what they're going to eat and then make the thing they're going to eat and then eat the thing they're going to eat. They're busy living their life. And so we have to make it very integrated with people's daily routines in order for it to really be effective and a strategy you can use. So all that is to say that I think that it's not straightforward to tell people to eat more vegetables and fruit. It's good for you. So.
You kind of led into what I was going to ask next too, because we're talking about culinary medicine and, teaching people and looking at where their food supply is, and really going a step further. Julie mentioned we kind of go farm to table in our podcast and talk about what happens on the farm and getting that into the consumer's hands. How would you recommend that some of our farmers get integrated into this system? I mean, there's a lot of local foods, there's a lot of small farmers. How do we integrate into that whole culinary medicine system with our agricultural system?
Yeah. I think there's groups of people. I know here in Arizona, I don't know if you're Local First Arizona. There are groups that are advocates of economic development, right? And also including producers, including entrepreneurs, that are amazing at connecting the dots. So I don't know about other states. Arizona is particularly rich in that kind of thing, I feel like. I guess that's sort of a mechanics question, or a mechanics answer, but I think in terms of how to integrate or how to partner is and what are the incentive structures in place for partnering is another question that's really important. And we have to recognize that a healthcare organization that's delivering the care to people and kind of frontline prevention have to be able to bill for services and have to be able to recover costs for things, and the same for the growers. You need to be able to sell your food at a profit and stay alive as a business. And so I think those types of things are important to discuss up front in any partnership and figure out the right kind of connection and structure. And so something that we've been exploring in the context of our project, we've explored a couple different ways of integrating agriculture. And one is through grant subsidies. USDA is particularly good at connecting agriculture to consumers in different ways. And we've been really fortunate to partner with organizations that have USDA funds to make those connections and make food more affordable for people as well. And it helps on the consumer end also. Beyond that, it's really the healthcare organization can also and the companies can also get reimbursed for certain deliveries of food and for certain healthcare activities under Medicare and Medicaid. But it differs state by state if that's available. And so having food as medicine be nationally available means that states would need to individually act or maybe hopefully collectively act to make that available and that reimbursement system. But financial incentives are, maybe awkward to talk about, but really important, because ultimately at the end, you're not going to make a partnership that's not going to benefit you if you're a business.
Yes, it's that whole sustainability issue, and a primary sustainability component has to be profitability, and especially for our small farmers, because it can be a challenge. Which brings us to another point, the logistics challenges. But we do have a few more food hubs as of 2025 compared to 10 years ago. Any commentary on that from your perspective, knowing what you're embedded in, Melanie? Are we getting where we need to be with the logistics? And
yeah, I think I'm just thrilled that's the case, that there's more. And to me, that's headed in the right direction. I don't have a specific comment about that, other than I think that just shows that people are enthusiastic about this and about making the kind of connections that we're talking about here, and having these spaces that allow that, kind of foster that innovation. It's not one way or one model to make it happen, but I think that, having communities sort of create their version of that is terrific as well. And that's what I've been seeing, at least, and really encouraged by.
excellent.
That's great. And so I have to ask you this. What's next? Where would you like to go from here in terms of research and culinary areas looking at food as medicine?
Yeah, I think our next steps, what we're really interested in with our Fresh project in particular, is understanding, how does food as medicine change people's healthcare utilization? So we know a lot of people don't interact with the healthcare system very often because it's expensive, number one, often for people. But it's always in this kind of, we're going to fix you mode, and you have something wrong and you're going to seek out care for an ailment, and not on the prevention side. And so we're trying to explore, if we provide basic food and help people meet basic food needs, to help them manage their diabetes, does it help with that? Does it help with them personally and their health, number one? But number two, does it change how people interact with the healthcare system? In other words, are they moving from more reactive sort of treatment visits to prevention visits? Can we move them to go see a dietitian a few more times than maybe they would have, or at all? Does their prescription medication change in any way? Are they refilling less or more, depending on the type of medication? And those types of behavioral shifts have cost implications for payers, for the organization, and for the person themselves who are looking to prevent or manage a disease. So I think that's where we really need to understand what's happening, and that will be, I think, important information for lots of stakeholders involved in these programs.
Yeah, I'm excited to see that. That would be amazing.
That is. One of my personal takeaways from our discussion today, Melanie, is that I think food as medicine is a value proposition, whether we have a chronic disease or not, because if we're treating food beyond just taste and price and the fact that we have to eat in order to live, but we look at food as medicine, there's a whole lot of things we could potentially prevent. We hear about quite a percentage of Americans that are pre-diabetic. Well, again, I'm very convicted from this conversation that you really built into my psyche that for all of us, food as medicine should be something considered. And it doesn't sound like it's too complicated. So that's another encouraging word to me. I mean, there is points to it, especially if you weren't raised in a home that stuck to the basics, that had a house full of good cooks and stuff like that. But it can be complicated for someone that's never really treated food like the way food should be treated, and recognize it and kind of respect the whole aspect of how it can be good for our health. So you truly inspired me today.
And I was just going to say, I actually like the term culinary medicine better than food as medicine, because unless you can combine that taste and enjoyment with the medicinal qualities you're getting from the food, you may not get the application you want from the average consumer. So
Good point.
I think having that culinary piece there is fantastic.
Yeah. So this is a question we most often ask our guests, Melanie, is like, if you want to give us 2 or 3 takeaways so we can make application for our listeners, what are your 2 or 3 takeaways?
Absolutely. I would love that. Well, one is certainly, I would love everybody to consider food as a primary prevention strategy for chronic disease. Think about food first because it can do so much for you. And I know it's easy to say and hard to do, but that is absolutely what I would recommend. And the second thing, maybe what we were all talking about a little bit earlier, which was about minimally processed foods being at the foundation as well. So shopping the perimeter of the grocery store, focusing your diet, a large bulk of it as much as possible on foods with minimal ingredients added and minimal processing, because they are definitely have the least amount of sort of added sugar and added fats and things that are not as healthy for us. But then I think you just made me think about a third thing that is really important that you were alluding to, and that is the enjoyment of food. This is important to all of us as humans and is a drive for us to eat. We want to enjoy the taste of the food, but also enjoy it with people, and I think the opportunity here at Food as Medicine, it may be beyond the nutrition component and the economic impacts we've talked about, but also the bringing people together part and the social part, which is really important, traditions and things that are connected with food as well, because I don't think we always do a good of a job here in as we could. And a colleague of mine is from Italy, and when we did I think it was the Mediterranean Diet Conference, perhaps, Julie, when you and I met, I don't know, a decade ago or so.
It was actually.
I thought so too. I always remember from that meeting that the Mediterranean diet pyramid, the food guidance in Italy, has conviviality as part of the base of the pyramid. The getting together and having enjoyment around each other as well as what you're eating is like a super important part of health and of nutrition. And I love that. So we should add that to our food as medicine kind of umbrella, is gathering.
Great idea.
Yes, this has been very insightful. I feel much more inspired and kind of appreciate the whole food issue more, because if we do it right and we bring enjoyment to it, it can also not only keep us alive, but be a preventative medicine strategy for us as individuals. Yeah.
So, in other words, save money.
Yeah.
Which everybody wants to do too.
Yeah. So thanks again. We may have to have you back, Melanie. Thank you so much.
Thank
for this.
you. Really appreciate it.
I would love that. Thank you so much. It was great being here. I appreciate you both.
Thank you.